In this video, we're going to talk about 6 of the most common reasons testicles can shrink. My name is Dr. Saif Gallagher. I am a plastic and reconstructive surgeon based here in Miami, Florida, and a significant part of my practice is testicular enhancement. And I'm going to talk about the 6 reasons people most commonly end up in my office because they've had shrinkage of the testicles. So number 1, by far and away the most common, is anabolic steroids. Illegal anabolic steroids for bodybuilding, for example, are just always a bad idea. They tend to be structured, as far as your body is concerned, a lot like testosterone, but are used at higher doses than, let's say, we would use for testosterone replacement therapy, and therefore they can do incredible damage to the testicles, because what they do is they signal to the brain that testosterone is coming in from outside, so we shut down the factory in the testicles, and with that comes shrinkage. Depending on how long the patient has been using the steroids, it may be reversible, but I see many patients in which it really just is not. Reason number 2 would be testosterone replacement therapy. It's very common. We're seeing more and more men being put on this. Usually at the same time, they will be started on HCG therapy, which helps decrease the chances of shrinkage, because similar to the steroids, if you're taking testosterone from outside, it tells the brain to shut down the factory, i.e. the testicles, and they do shrink. But this can be prevented by HCG, or clomiphene is another drug, which is a luteinizing hormone analog that can keep the testicles the same size as they were. Another one we do see pretty commonly is folks who've used marijuana chronically. So this has been shown many times in the animal model that marijuana definitely seems to harm the seminiferous tubules in the testicles themselves, and with time can cause shrinkage. Same thing, usually it seems to be reversible if the marijuana is stopped. It doesn't matter if it's smoked, if it's edibles, whatever way it was taken. However, in many patients this may not be true, so it can shrink the size of things as well with time. Another reason we see is alcohol use. Usually you need to have pretty excessive and chronic alcohol use. So in the case of alcoholics, it's very common to get testicular shrinkage and atrophy as well. This seems to be because of the toxic effect of the alcohol on the cells of the testicles themselves. And this one, in some animal models, it seems to be less reversible even when the patient does stop alcohol use. Next one we see is fairly common. It's a disorder called varicocele. Varicocele just means that there are veins around the testicle, in the testicle, and you can get, same ways you can get varicose veins in your legs because the veins aren't functioning too well, the valves are loose. Same thing can happen in the testicles. There is an association with infertility and atrophy or shrinkage, but it's not very clear. In one study, for example, 80% of men who were found to have varicoceles had no infertility whatsoever. So therefore, this link is a little bit less clear, but an untreated varicocele may cause shrinkage of the testicles also. And then the final one we'll talk about, which thankfully due to immunization is a lot more rare these days, is orchiditis. And so that basically means inflammation of the testicle caused usually by an infection. So mumps was the classic one. Now, thankfully, we don't see that very often because we have vaccinations for that. But you can also get it eventually through epididymitis, which often comes from an STI. So this tends to be in cases where it's been going on a long time and it's been untreated. This can eventually lead to shrinkage of the testicles themselves. There are other causes, not in my top 6. Genetic causes I do see very often as well, or just congenital, just people are born with small testicles. It's no disease per se. And then sometimes I see patients who have what we consider normal sized testicles, but just want to enhance them, want to go bigger, and that's perfectly fine too. And so in my practice, typically how we enhance the testicles surgically is to place an implant. So Very similar concept to breast implants, which we all know about that in the world of plastic surgery. We leave the natural testicles alone and put in implants down there. So technically you have a 4-pack, but you can't see that you have a 4-pack because the new implants are big enough to hide the native testicles. We leave the native testicles in there because they're producing sperm, they are producing testosterone, and so in most patients we will leave them behind unless there's a reason to take them out, and so in those patients, like I said, the incision will be made low down on the scrotum because a very common complaint is the testicles don't hang low enough. And so we'll put our implants in there. We spend a long time deciding with patients what the appropriate size for them is. It just has to be big enough to hide the natural testicles so we don't see that 4-pack situation going along. I always use soft silicone testicle implants. You can use saline implants. I find they're not very well tolerated by patients. So sometimes I see patients who've had them placed elsewhere and come to me for the softer type. They tend to be much more natural feeling and well tolerated. But this is one very effective way you can enhance the appearance down there if you have had testicular atrophy or you're just not happy with the appearance of the testicles as they are, regardless of the size.